And founded in Texas in 2004, the Valentine Obioma Ohaji Memorial Foundation, VOOM Foundation for short, is a private international medical humanitarian organization established to raise the standard of care and create a sustainable medical program in Nigeria. And over the past 8 years, the organization has completed 27 successful missions to Nigeria, providing independent and inclusive medical services to members of the society in need. Well, their most recent mission was this month of September 2021, and Arise News Correspondent Laila Johnson-Salami spent some time with members of VOOM while they were around. And she sends in this story on their quest for improved healthcare in Nigeria.
At the age 56. In Nigeria for something that was easily treatable even in an average hospital in the United States. And I eventually evaluated opportunities in Nigeria to realize that a lot more people are dying for far less than what killed my father. And this was my attempt to at least try to see if we can improve the standard of care in this country. And hopefully in the future that nobody else will die like my dad did. My name is Dr. Vincent Ohaji, and I'm a trauma surgeon by profession in the United States. I'm also the president and founder of the VOOM Foundation. VOOM Foundation was started in 2004. We started by coming and looking at all the hospitals that we can get our foot into the door. It was very difficult for me to imagine that a country of over 190 million at the time did not have a single center where open heart surgery was being conducted in a consecutive manner. And so our job at that time changed. Maybe we can do something in this arena, and that is exactly what led to VOOM Foundation, working our way into open heart surgery.
My name is Reza Kodaverdi, and I'm a cardiothoracic surgeon from the United States. I'm here volunteering my time for VOOM Foundation. From the day first, I was drawn to the organization because I felt like that it has a very valuable mission. It's providing a service that is not available. All the procedures we are doing is life-saving and quite critical for this, these people who are suffering from end-stage heart disease.
It's really a wonderful feeling being able to come back home. I've always known that I was going to come back to do something of this sort, and being able to do that now that I'm kind of done with my training is great. And it's also great that people who aren't even from here are able to come back as well with their various skills as nurses, as surgeons, as circulators, as anesthesiologists, and give to my homeland as well.
Well, we started with a mission a year, and then it morphed to 2 missions a year, and now we're doing a lot more than that. And of course, we've ventured out from the UNTH to LASUT to now First Cardiology, and in fact, we just started a program at the University of Calabar last week. And so it means we're doing really 2 or 3 medical missions a year, and that is like scratching the surface of the need for sustainable cardiac surgery in Nigeria.
I've never been across the ocean before, so it's been an experience for sure, and it's kind of crazy to see how people live here and like the equipment that they're able to have and all the stuff that is missing, basically.
You have to realize that open heart surgery has happened in Nigeria before. I think the first open heart surgery that was conducted in this country was in 1974. So you will be hard-pressed to know why it is that the program, stopped in 2001. So the same challenges exist today, except even more complex. The population has grown more than it was then, and poverty level is much higher than it was. So I think the people who are able to should do what they can to try to support those who can't afford it.
To put a medical mission together is a very big task. You have to get commitments from volunteers. We have to, make sure that we have the financial means to get here. I am a development professional, basically. I've raised money for foundations all my life. I took my first trip to Nigeria, and I saw how different things were here than what we have there. And on the plane on the way home, I said to myself, I'm pretty good at what I do. I can raise a lot of money and get people involved and get people engaged. And I felt at that time that I wanted to do it where I'm needed the most.
If we cannot have a center where a lot of surgeries are being performed, it will be near impossible to train somebody that can actually perform the surgery here, so that we will begin to rely less on people coming from overseas. It would require a whole lot. It would require companies, it would require wealthy individuals, being able to invest in this. And then, of course, charitable organizations from overseas like ours can also work to bring labor.
There's a huge amount of work which goes in behind. It's very much not turning up, doing the cases and leaving. But a lot of energy, time and money does go into this, and it can only actually continue because of the donations which are generously given by so many people.
My ultimate goal, obviously, would be to move back to Nigeria. I don't hope to die in the United States, I love what I do, but I think I will be a lot more helpful by being in the United States and being connected. And I say that only because, just imagine, for instance, if I decided to move back to Nigeria right now, you know how challenging it would be to start a mature trauma system. We do not have 911 system. We don't have good roads to be able to bring a patient from point of injury to where they're going to be well cared for. People don't respect the ambulances, so traffic is going to be an issue. And then even when they come into the hospital, there is no system in place, even within the institution, to where an injured patient that shows up can be cared for, people in different disciplines, without you having to find a neurosurgeon, go find a cardiac surgeon. I mean, if you're injured and you showed up in the hospital in the United States, you don't have to look for all those things. The system is already in place for you. You follow what I'm saying? So I feel like I could do a lot more for the country by doing what I'm doing right now, where I'm connected to industry, connected to other institutions, connected to volunteers, but at the same time connected with different institutions here that I can be able to bring both together. I cannot begin to imagine how successful I will be if I move back today and I'm trying to reach, say, Edward Life Sciences United States to donate consumables from here in Nigeria.
There is a very big problem here as far as those who have access, the haves, and those who do not have access, the have-nots. People who have access either have access to the best health care in Nigeria, or they can go abroad to seek better health care. And that is simply not an option for a lot of people here, for the majority of people here. So I think the hope is that you give people not just access, but the means to be able to afford that access, and that would be ideal.
My best part about my job is when I see my patients do well. First mission in Enugu, I operated on a patient. I did a mitral valve on him, and we extubated him that later afternoon. I asked him if he was in pain. He said no, and I asked him, what are you thinking? Do you have any question for me? And the first thing he asked me is that, when can you start farming? So that's something that stays with me, that we feel like, this guy was sick, probably at death door not long ago. He had surgery, he's in pain, he's recovering. He's just right after, you get the tube out of his mouth and he can talk. The first thing that comes to his mind is to go back to work and provide for his family. So that by itself, to me, it's a great success story.
I would love to see a day when there is no need for medical missions to happen. For me, that would be success. Like today when I will pick up the phone and call, the director here of First Cardiology and say, we're planning a mission for next year, and he says, no need, because we got this. That to me is the day that I'm looking forward to, and I'm not sure when that's going to happen, given the enormity of the problems that we have today.